The Rehabilitation of Walking Upstairs.
By Ton Van Nguyen,
Valerie Araya,
Courtney Alexander. Our goal of walking upstairs while carrying weights and avoiding other individuals is specifically geared to post-op patients recovering from a complete Achilles tendon rupture. The purpose of this skill is to provide a real-world activity as the patient goes through these rehab milestones.
This is a visual demonstration of a patient walking upstairs carrying weights while avoiding people.
The critical factors associated with this skill involve and are not limited to ankle range of motion, weight distribution, an important factor in such how the exercise is being performed. Poor posture is usually indicated when patients lean forward while stepping through. Good posture is usually indicated when patients are able to maintain an upright position. Step clearance. Given a minimum height of 6 inches for every step, some individuals will be able to achieve this better than others, usually due to height or age.
The flexible factors that are associated with this skill include, yet not limited to, step technique, whether the patient places their foot or heel down first, step pattern, stepping on steps with just the right foot, left foot, or alternating, step clearance, for reasons discussed earlier, and speed, dependent upon how fast or slow a patient performs the task. In accordance to Gentile's taxonomy, less complex skills include starting with 1B. Within the 1B category, our skills include standing bilateral heel raises. All of these activities involve body stability, no object, stationary regulatory conditions, and no intertrial variability. After completing standing bilateral heel raises, we can make the exercise more challenging for the patient by increasing the heel raise repetitions. For example, starting at 5 repetitions and increasing it to 10. We can also make this exercise more challenging for the patient by having them stand on one leg and perform a single leg heel raise. From 1B, a more complex skill would involve moving into 1C. Skill in 1C can be demonstrated by walking upstairs without weights. All of these activities involve body transport, no object, stationary regulatory conditions, and no intertrial variability. Increasing the speed will result in increasing the complexity. Another way to increase complexity is having the patient alternate steps.
a more complex skill according to the taxonomy places us in 1D. Our skill in 1D is walking upstairs while carrying weights. To increase complexity in 1D, we will increase the weight being carried. All of these activities involve body transport, objects, stationary regulatory conditions, and no intertrial variabilities. Another way to increase complexity in 1D is by walking upstairs with weights while performing bicep curls. According to the Gentile taxonomy, walking upstairs while carrying weights and avoiding other individuals fit in the 4D categories. The 4D requirements include body transport, object, regulatory condition in motion, and intertrial variability.
Patients will be able to move on to the next level once fulfilling at least 2 of the following: repeated correct technique, increase in ankle range of motion, and increase in ankle stability.